Can you imagine having aches, chills, nausea, and a severe fever, only to find out it's malaria? You know you need medical attention quick, as malaria can become fatal, but you're scared. In the hospital, you'll be placed in a 105-degree room, maybe not have a bed to sleep in, be separated from your parents, from your friends, and from your schoolwork, and have absolutely nothing fun to take your mind off your illness. Not to mention the stigma surrounding hospitalization is huge, and you don't want anyone to think differently of you. You see, this is the reality for thousands, if not millions, of kids across the world. 5.4 million kids die every single year from easily treatable diseases such as malaria and pneumonia. But part of the issue is that the hospital remains one of kids' 4 biggest fears. I'm Malcolm Asher, I'm 16 years old, and I'm working towards a solution that no one yet has provided. But first, let me backtrack. When I was in middle school, I was introduced to volunteering when I tagged along with my older brother to go downtown and hand out food to the homeless population. I was so incredibly inspired by his work, and I wanted nothing more than to follow in his footsteps. Since kindergarten, I've been fascinated with the human body and medicine. So when I found out you can volunteer at the Children's Hospital when you turn 14, I pounced on the opportunity. 3 application cycles later, I was offered a position to volunteer in the Child Life Department. On my very first day, I was placed in the Oncology Hematology Outpatient Playroom, where I saw about 15 kids going through a very uncomfortable and vulnerable time. These kids were hooked up to blood transfusion machines and had needle ports sticking out of their bellies, and I wanted nothing more than to alleviate some of that pain they were going through. But what could I, a brand new volunteer with no medical experience, possibly do for them? Somehow my mind went to drawing, something that always sent me to another world when I was a little kid. After finding a stack of construction paper and getting a bucket of markers, I encouraged all the kids to come and draw with me at the craft table. But what happened next was absolutely shocking to me. One of the patients, a 7-year-old girl with a very late stage of cancer, created a drawing and went over across the playroom to give it to another kid who wasn't coloring with us. I expected her to make her drawing for her parents or maybe for her hospital room, but it was clear that that experience of sharing her art was completely life-changing. The receiving patient's eyes lit up and her entire demeanor changed. It was clear that she was more positive, confident, and courageous. And those effects were mirrored in the giving patient. The next day, and for the rest of the summer, I was placed in the hospital's extended stay units, where I worked with kids who were in the hospital for days and weeks on end. After talking with kids and their families, it was clear that they felt a huge amount of isolation in their units and didn't have those organic opportunities to share art like I saw in the outpatient clinic. Every time I had a conversation with one of these kids about their fears, my mind would immediately race back to that experience I had in the oncology outpatient playroom. After a few months volunteering in the hospital, I went home wanting to volunteer with an organization that really focused on that sharing aspect of art therapy in the hospital. After doing a few weeks of research, I was so surprised to find that there wasn't a single organization that was focused on that aspect. I knew that if there was going to be any change, I'd have to make it. I started by researching the most basic questions, like what are articles of incorporation, what's an employer identification number, and what's 501c3. I knew that the best people to help me would be other young changemakers who had been successful in their own journeys. These teens gave me priceless advice that helped craft the foundation of my new project. From there, I wanted to meet with as many healthcare professionals and child life specialists as I could to gain their support. While many of these professionals rejected my request to meet, some even shooting down my idea, the few that supported me fueled me to see my idea come to fruition. Knowing that I needed a lot more support, I went to some of the largest art therapy-based nonprofits in Portland, Oregon, where I live. Thankfully, most of these organizations saw the potential to bring something completely new to art therapy and change the hospital experience as we know it. I started to share my idea with as many people as I could. While many adults told me to focus on my schoolwork or to stop competing with a real nonprofit, change was right in front of my nose and I could almost grab it. I brushed all these comments off my shoulder and kept the end goal in sight. After 6 more months of legal work, meetings with hospital administration, and building new partnerships with organizations and companies, ArtPass was born. Today, ArtPass has transformed from my idea of a sharing art program to a global 501c3 nonprofit that's seeking to change how kids across the world perceive and experience the hospital. We're looking to diminish the stigma around hospitalization, encourage more kids to seek out medical attention, and improve the overall quality of life in the hospital. With the help of our ArtPass Global Ambassador Network, we've registered 24 chapters across the world. Every day, kids and adults from some of the most remote areas of the world message me to tell me how big of a need there is for art programs and initiatives in their local communities. Many global health-based nonprofits are reaching out to us to ask how we can provide art supplies and their shipments of medical supplies to hospitals across the developing nation. And our global ambassadors are now going to schools to teach kids about the importance of seeking out medical attention and showing how the hospital doesn't have to be such a scary place. From this experience, I've learned how far ambition and drive can take you, and how age doesn't have to define the impact you can make. We've been able to reach thousands of hospitalized kids thanks to the support of so many child life specialists, healthcare professionals, nonprofits and companies, and friends and family. It's so easy to forget that kids can make a difference. If there's one message I have for other kids and teens, it'd be to follow your instinct. Because if your passion is big enough, there are so many people out there who want to help you make the world a better place.